What needs to be done prior to the procedure?
Well, the night before breast augmentation, we have all our patients shower with a Hebe cleanse, which is called chlorhexidine. And this cleanses and gets the bad germs off the body. So we have them lather up their armpits and their chest and torso and stomach and so forth to help cut down on infection. Then the next morning when they come into surgery, an IV is started, and I come in and I'll mark out the whole plan on the chest, and the patient looks in the mirror and verifies that I've got the right size, that I've got the right placement. You know, we can put the implant in a little closer to the breastbone. We can just center it right behind the nipple. Sometimes they need to have the crease drop down, so we drop the crease down. We mark that all out on their chest, and they verify the size and the incision. So if they were looking for a 350 cc implant and I write 600 there, they'll know I mixed up with maybe an entertainer that I'm doing that morning. And then they're brought into surgery, and we give them intravenous antibiotics to help kill any of the germs specifically that might cause a breast implant capsule. We use things called nipple shields, which are clear sterile plastic put over each nipple so no drainage comes out during the procedure that could contaminate the case. Now there's a lot of controversy on which incision has the lowest infection rate. But I'm going to tell you that there's two large studies of over 1,500 patients. One was 1,670 patients who had breast implants to the armpit, and the other study was 2,000 patients exactly who had breast implants to the armpit, and it showed that the infection rate was actually slightly lower than the incision through the nipple for sure, and also the incision through the breast crease. So you may get conflicting information about this, but don't be alarmed because all these rates are extremely low. And then during the surgery, we rinse out the pocket with a triple antibiotic solution to kill any other things that might be on the instruments or the implant, just anything we can do to cut down your infection rate. And then you go home about an hour after the surgery, and we want to have you up and around that same day at home, and 95% of the patients will be back to normal activity the next morning.